When should you change lactulose dose for HE symptoms? Managing hepatic encephalopathy with lactulose is all about finding the right balance. The goal is to keep ammonia levels low by controlling bowel movements. Typically, healthcare providers aim for 2 to 3 soft, loose bowel movements each day. If a patient has fewer than 2 bowel movements daily, or if their mental state does not improve or gets worse, it might be time to increase the lactulose dose. This helps remove more toxins and can improve symptoms like confusion or altered consciousness. On the other hand, if the patient develops diarrhea that is too frequent or severe, or shows signs of dehydration or electrolyte imbalance, the dose should be reduced. Excessive diarrhea can lead to dehydration and electrolyte disturbances, which can actually make hepatic encephalopathy worse. It is important to monitor for abdominal pain or discomfort, as these can also signal that the dose is too high. When starting lactulose, the usual initial dose is about 20 to 30 grams taken 3 to 4 times daily, or 15 to 45 milliliters 1 to 3 times daily. The dose is then adjusted based on how the patient responds. If they are not having enough bowel movements or their symptoms persist, the dose can be increased gradually. Conversely, if they experience too many loose stools or signs of dehydration, the dose should be decreased. In severe cases, especially in hospitalized patients who cannot take medication by mouth, lactulose can be given through a nasogastric tube or as a retention enema. These methods requiring close medical supervision to avoid complications. Regular assessment is crucial. Doctors will monitor bowel movement frequency, stool consistency, hydration status, and electrolyte levels. Overdose can lead to problems like ileus, severe diarrhea, or hypovolemia, which can worsen hepatic encephalopathy. Blood sugar levels should also be checked in diabetic patients because lactulose contains sugars. Long-term use of lactulose to prevent recurrence of hepatic encephalopathy also requires dose adjustments over time. If symptoms do not improve despite dose changes, healthcare providers should look for other causes like infections, gastrointestinal bleeding, or electrolyte issues. Sometimes adding other medications like rifaximin can help. In summary, adjusting the lactulose dose depends on how well the patient is responding. The key is to maintain the right number of soft bowel movements without causing dehydration or other side effects. Always make these changes under medical supervision and consult your healthcare provider for personalized guidance.